I've seen people saying this. Autistic people don't make eye contact because they don't care about other people.
That's a crazy interpretation.
It is. Well, and the truth is that eye contact just doesn't do the same thing to me that it does to you.
Hello, team, and welcome to Bureaucracy. I'm your host, Emily Gross. I'm very excited today because I have Zoe Gross with me, who we don't think is a relative, but we don't know. And Zoe is the Director of Advocacy at the Autistic Self Advocacy Network. Zoe, thank you so much for being here today.
Thank you for having me.
So we're going to be talking about RFK Jr.'s recent comments in the news, who's the new Health and Human Service Secretary, which is scary on multiple levels. And we're going to be talking a lot about autism, what it means to be autistic, the actual research behind autism, and try to dispel some of the misinformation that he seems to love putting out into the world. So Zoe, thank you for being here.
Thank you.
So my question I always love to ask is, why should we trust what you have to say?
So first of all, you should trust what I have to say because I'm here representing the Autistic Self Advocacy Network. We are the largest organization in the U.S. run by and for autistic adults. We've been around since 2006, advocating all that time for policies that benefit people with intellectual and developmental disabilities. For me personally, I've been working in disability policy and advocacy for a little over 10 years now. First in the Senate, working on the Health, Education, Labor, and Pensions Committee, and then at the Administration for Community Living, and then at ASAN, where I am now.
Awesome. Well, there's no one better, I think, to have to talk about this than you. So very happy to have you. Before we dive in, what are we drinking?
I'm drinking a fancy farmer's market lemonade with a little bit of vodka in it because it's been that kind of month.
Good for you. We love to hear that. Also, one of my favorites. And I am drinking a beer called Surprise Surprise. And I just thought it was fun and I liked it. And, you know, just was waiting for RFK Jr. to add on to the other fucked up shit he says. So surprise, surprise.
He certainly surprises me.
Yeah, truly. Anyways, cheers.
Cheers.
So his comments kind of sent shockwaves through the autistic community, right? And what was your experience and what was ASAN's response to his comments, which was one, really kind of generalizing the autistic experience, and then also talking about finding a cure for autism? What's the thoughts on that?
So there's many things that are alarming about what RFK Jr. said about autism this month, and there have been a lot of comments about autism this month coming from him and from HHS generally. One of the most alarming things is that he has said that they will find the cause of autism by September. Now, people have been studying the cause of autism for decades, and we haven't found it yet. But in the next couple minutes, apparently, we're going to do that. And everyone get ready. So what's concerning about that is that RFK Jr. is a firm anti-vaccine, I don't know if I want to say advocate, but yeah, he's against vaccines. He believes or claims to believe that vaccines cause autism. And in his confirmation hearings, he claimed not to believe that, but his recent actions are very concerning. Specifically, he hired a man named David Geyer to work on this autism study that HHS is going to do. David Geyer is another anti-vaccine advocate. He and his father have put out flawed studies that, because of methodological errors, found links between vaccines and autism when really there are not any. They also experimented on autistic children with high doses of a drug used to treat prostate cancer, for which David Geyer was fined $10,000 for practicing medicine without a license because, by the way, he's not a doctor.
So that's crazy. Didn't realize that one. Okay, that's good information to have.
Yeah, just a little fun tidbit about the autism study that's coming up. In terms of RFK Jr.'s other comments, are you thinking about the autistic kids won't pay taxes, go on a date, play baseball thing?
Yes, I'm definitely thinking about that one because that one was like, what?
It was like that. Yeah, it was pretty alarming to hear him say, I think all of the things he says we're not going to do are pay taxes, work at a job, write a poem, play baseball, go on a date, or use the toilet without assistance. And there's a couple things about those remarks. First of all, they're not true. There are
setting the record straight immediately.
Yes, just to make it clear, there are autistic people who do all of those things. there are, there's professional autistic baseball players. There's softball in the Special Olympics. There's autistic people writing poems, speaking autistic people, non-speaking autistic people. DJ Stavries is a very well-known non-speaking autistic poet and advocate. I couldn't find stats on the rate at which we, for example, have romantic relationships, but plenty of us do that.
There's a whole Netflix series all about it right now.
There is, yes. And according to a couple of studies I found, about 60% of us are employed at the moment. So that's one thing. The other thing is that there are people who don't do any of those things that RFK Jr. mentioned. And they can still lead happy, full lives, and they deserve better than to be used as a rhetorical prop to make people scared of their disability.
I think it's really hard, right? Because, for like the neurotypical community, the way kind of autism was kind of understood was when the term Asperger's was still being used, which it's not anymore, and then autistic. And there's kind of this, I feel like, differentiation in people's minds.
Well, so the thing about these terms, whether we're talking about Asperger's or terms like high functioning and low functioning, are that no one can agree on what they mean. And for that reason, we recommend they not be used. So that one of the reasons why Asperger's was taken out of the DSM as a diagnosis is that it varied clinician by clinician where they drew the line between that and autism. And people would say different things. Some people would say if there's no speech delay, it's Asperger's, not autism. And some people would say it's about how they presented their current lives. And some people said different things. And the same with high functioning and low functioning. People claim that there are all these traits of autism that are correlated with each other. Like autism is a kind of on a slider, and you turn up the level of autism and the traits increase. Really, autism is more like a salad bar where everyone has a different amount of different traits. So it's not the case that, for example, if someone isn't speaking, you can tell for sure that they don't work. And it's not the case that if someone does work, you can tell that they don't need support at home. And it's not the case that if someone has an intellectual disability, you know that they don't play baseball. So there's a lot of things that people think go together that might not really. And that's why we try and just be accurate and describe how people's disability affects them and what they need, rather than saying things like high functioning.
Thank you for educating me. That was a really helpful picture, the salad bar. That was like a great metaphor. So thank you.
Oh, thank you.
That was awesome. Yeah, no, that was really helpful. So thank you for educating me on that. People are trying to, I think, and one of the great things about ASAN is the fact that you guys are like, when we're talking about autism, crazy thought, maybe you actually have autistic people as part of the conversation, which should not be shocking. And it seems like, unfortunately, that's not part of the reality for the most part. So I think you being able to clarify, be like, no, people who do have autism prefer if you do it on an individual basis rather than in the neurotypical world where we say, use the incorrect terminologies of high or low, right? I think, and this happens with a lot of people that I think are lumped together. It's like you get rid of the individuality, and RFK Jr. has gotten rid of the individuality, and that's really scary.
Absolutely. And it's sad because his family's legacy is one of trying to make progress in particularly policy around intellectual disability after Rosemary Kennedy was given a lobotomy, and it really negatively affected her life. And because they didn't want that to happen to other people, they started to promote, more enlightened disability policies. President Kennedy started the President's Council on People with Intellectual Disabilities, which is still around today. Family members started Special Olympics, which is one reason why RFK Jr. should know that we can play sports. But
truly,
yeah. So there's a lot of progress that has been made that he's just kind of trying to put in reverse. And it's very unfortunate.
Yeah. Especially vaccines, really important, And like you said, there is absolutely no it has been debunked multiple times that there's any tie between vaccines and autism.
Right. And what he says about the studies is wrong. So he'll claim like there were flaws in the studies. They've done studies with all kinds of different methodologies. They've done studies in different countries. They've done studies with different data sets, different universities, different governments. They all find there's no link between vaccines and autism. So really the science is in on this. It's been pretty thoroughly debunked. It was only ever proposed in the first place because a man called Andrew Wakefield wanted to make money selling the MMR vaccine as 3 separate shots instead of as 1 shot. So he said when you give it as 1 shot, it causes autism. And because of his unethical actions, the paper that published that study retracted it and said, never mind, we don't support the conclusion that he drew. And that was the only study, that was where it started, the idea that vaccines cause autism. And it's been shown to have been fraud. But people still believe it sometimes.
That's a fun fact, not so fun fact that I had no idea. That's really interesting. Yeah. And unfortunately, we live in a society now where people don't believe facts, which is cuckoo. But so, right. There's been this increase of autism that has been found. And I think it was like a 3.2% increase. I think it's like 1 in 31.
1 in 31 now, yeah.
Okay. What could explain this increase?
So across the board, what experts in autism think is most likely is that we are learning more about autism and how autism presents, and especially how it presents in different groups of people. So, for example, there used to be a big racial disparity, a large gap in diagnosis based on what race you were. So, if you were a child of color, you were much less likely to have an autism diagnosis than a white child. It's only in the last couple years that we're seeing that turnaround. And seeing in studies that children of color are receiving similar rates of diagnosis. So when you get rid of a disparity like that, where one population is now being diagnosed at a higher rate, it will bring the overall prevalence rate up. And then also across the board, we're understanding autism better. People who are doing these studies understand more about the traits of autism. They're relying less on stereotypes. They can recognize autism in wider groups of people, including people who might mask or camouflage the traits of autism, which is, can be happening as young as 8, which is the age that this study is studying. So that's what most people think is happening. And then what some people think is happening is that there's a scary outside cause that's leading to more and more autism. And sometimes they even like to say, it's just the rate is going to keep going up forever until we do something. And really, there's no indication that that's the case. While the rate of diagnosis goes up year after year, the rate at which it goes up is slowing. So we're approaching a plateau where we'll have identified roughly, the amount of autistic people that there are, and then it won't go up anymore.
Interesting. Very interesting. And so what does the research show about autism? What has research found about what may be one of the reasons why autism exists?
So we know that autism is genetic. And we know that because there's many genes that have a correlation with being autistic. But there is no one quote unquote autism gene. So having one of these genes doesn't guarantee that you are autistic. Many of them are associated with different traits as well as with being autistic. And there are autistic people that don't have these genes. So it's going to be something complex about how the genes interplay, work together that we haven't quite solved. But we know it's genetic. We know it's hereditary, runs in families. And there is some initial investigation into things like parental age having something to do with it as well. Other than that, when we've looked at environmental causes, we're not really finding anything. Oh, except pollution. Pollution might have something to do with it.
Oh, interesting. Okay. I mean, maybe if RFK Jr. is so worried about autism, it'd be good if he talked to his EPA people to talk about maybe, I don't know, not polluting the world.
Yeah,
so.
I think they're kind of walking back the not polluting thing. And just paring down staff in many places in general. So, and getting rid of regulations. So there's likely to be more pollution. But he's not really worried about that because he's worried about vaccines.
Right. It's ridiculous. I think I just saw he was in Texas recently, which obviously has a huge measles outbreak, and was saying that the research between like autism and vaccines is more important than like vaccines being given for measles. And it's like, are you dumb? Like, this is crazy.
Yeah, and he's saying things like we can't just focus on preventing measles, we have to work on treating measles, implying that instead of vaccinating people for measles so they don't get measles, we should just be looking at how to get them through measles so they don't die. But there's a better way. We can vaccinate people and then they are immune to measles. And I have to say, measles can do things to you besides kill you, like wipe out your entire immune system. So you don't want to have it. Even if it couldn't kill you, you would not want to have it.
He's such a dum-dum. Is my nice way of saying that. So before this conversation, I was doing some research, and there is no cure to autism, right? And I've read, and I want to talk to you about the idea of there being a cure to autism is offensive to people who are autistic. What is your perspective on that? What is ASAN's perspective on that? Like, what's the general consensus?
So we're against the idea of looking for a cure for autism for reasons both because like personal and practical. In terms of our personal views on this, I would say as autistic people, we feel strongly that we wouldn't be the same people we are now if you were to somehow magically make us not be autistic anymore. Because autism is in so many aspects of our brains and how we view the world and what we do and how we learn, how we think. To make me non-autistic would really be to make me a different person. And then the practical reason we're against curing autism is because it's fucking impossible. And when we spend money trying to find a cure, we're using money unwisely that could otherwise be spent on research that would actually improve autistic people's lives.
Great. Said greatly.
Thank you.
So what can be done to help improve autistic people's lives?
Tons of stuff. I'm going to start with expanding Medicaid home and community-based services, which is a big policy goal of ASAN's. So for those that don't know, Medicaid is really the only payer at the moment for like long-term care, long-term services and supports in the United States. Private health insurance doesn't cover it. Medicare doesn't cover it, although Kamala Harris was proposing that it should, but it doesn't at the moment. Only Medicaid does. Or you can pay for it out of pocket if you happen to have a very large amount of money available to you kind of indefinitely. But assuming you're not independently wealthy, if you need this kind of services, you need to go on Medicaid. And what these services are is, let's think about people that need help with daily activities. So things like cooking, cleaning, eating, dressing, bathing, transportation, their daily routine, going to bed, waking up in the morning, all kinds of things that, if you give this person supports, they can thrive and they can live in their own home. Or if you don't give them supports, they might not eat food. They might not get dressed. They might not go out. And worst of all, they might be put in an institution. So these services are there as alternatives to putting people in an institution, because we know across the board, people do better when they're living in the community instead of in an institution, to the point where like their lifespans are better living in the community. So we really want to encourage community living, make that an option for every person. And to do that, we need these services to be really robust and widely available and top quality. To increase the quality as well as making them more available, what we need to do is make the pay for direct support professionals higher, the people that provide the services, so that there's less turnover, less neglect, that we're giving the respect to this profession that it deserves, and people can get the services that they need.
Absolutely. No, thank you for expanding on that. I'm a relatively neurotypical person, right? I have my like mental health issues, but generally the way in which I experience the world is considered very neurotypical. And I feel like sometimes a lot of neurotypical people have a hard time. And I sometimes think this can affect the kind of like empathy and desire to help make the world more inclusive, understanding what a person who is autistic might see the world and experience the world as. And obviously, this is such an individual thing. So I was wondering if you were comfortable to talk about what it is like for you to live in this world, how you experience it.
I think there's a lot of ways that autistic people experience the world differently. It can be very overwhelming for us because of our sensory issues. We often have difficulty with sensory processing. So, like the way your brain processes the information of what your senses are experiencing. For me, I'm very sensitive to noise. I'm sensitive to bright lights. The headphones that I'm wearing right now to do this interview, I often just wear out and about so that I don't get too overwhelmed by my senses when I'm, and out and there's an ambulance or whatever the case may be. A lot of people think that autism is just a social disability, but really it affects all kinds of things about the way we think. Even if it affects the way we move. And for many people, that's why they may not speak, is because of the motor coordination that's involved in speaking. And that can be anything from difficulties with speech to struggling to be able to start or stop moving. So, for example, getting up off the couch, if you're staying still, you can have what's called autistic inertia, and it can be hard to start moving. That's definitely something that I experience sometimes. A lot of us have difficulties with executive functioning, which is kind of the way your brain organizes itself and organizes information. And this affects everything from starting and stopping tasks to my brain has gone blank about what executive functioning is.
I'm
organizing information and recalling information and in a timely way, calling up the things that you know. That's part of executive functioning as well. I just had a problem with that, as you can see. But yeah, there's a lot about our experience that I think people don't know about. And then even what they know, they may misunderstand. So a lot of people know that autistic people don't like to make eye contact. And they may think, and I have seen this like written down, I've seen people saying this, autistic people don't make eye contact because they don't care about other people.
That's a crazy interpretation.
It is. Well, and the truth is that eye contact just doesn't do the same thing to me that it does to you. So I understand that eye contact is very important to non-autistic people and that they get a lot out of it, and it's meaningful and relationship enhancing and gives them vital communication that they couldn't live without, and like information on a minute-to-minute basis about their conversation partner and like a lot of other valuable stuff they get out of eye contact. I can't get any of that out of eye contact. And in fact, it makes me uncomfortable and it makes it harder to listen to what you're saying. And that's why I don't do it.
Which is so fair, like that's nothing that should be shamed.
I definitely think like a lot of autism interventions are focused on making us make eye contact. And I just think, why? Like, even if you want autistic people to act like neurotypical people, which you shouldn't want, eye contact is very easy to fake because we're not going to get out of it what non-autistic people get out of it. It's harmful to us to make us try to do it. It takes up energy that could be going to other things, and it's uncomfortable or aversive to us. But it's become such a hallmark of like, we must make the autistic people make eye contact. And I just think, why?
Right. Absolutely. I mean, do a lot of these, like, that's such an interesting point you raise. It's like, why should we want people who are autistic to play into the neurotypical world when the neurotypical world can appreciate and understand autistic people and make it easier and happier and better for everyone?
This is definitely something that I think about social skills when people use the phrase social skills. A lot of people will say that autistic people have poor social skills or need social skills training. And what I will say about that is that there are at least two people in every social interaction by definition. And if an autistic person and a non-autistic person are having trouble communicating with each other, we shouldn't assume that it's the autistic person's fault. In fact, I think they could both use to learn more about each other and their communication styles, and how to communicate with people who think differently than them. That's something that we could all use to learn.
Absolutely. So this leads into like, I think probably, one of the big questions, which is, as a neurotypical person, what can I do to help make the world a better, more comfortable place for autistic people?
Okay, so there's many things you can do. One is to promote autism acceptance in your daily life. If you hear people talking about how autism is big and scary, gently slip in the suggestion that it may not be, and that disability is a natural part of life. And while it can make our lives harder, it's nothing to panic about. What we need is support and acceptance. So you can help provide that support and acceptance by doing things like hiring disabled people for jobs and giving us housing and not discriminating against us in school and all those kind of things. But assuming that you're not someone that hires people for jobs or administers a school, there's still plenty you can do. One thing you can do is go to ASIN's website at autisticadvocacy.org and look at our action alerts, which will tell you what we're working on right now that we want people to contact their elected officials about. And if you do that, it really benefits us because you can help, for example, save Medicaid, which I talked about earlier is so important. That's something we're working on right now. You can help us do things like fight to end restraint and seclusion in schools and work to make sure there's better employment possibilities for autistic people, all kinds of issues that we're advocating on. Something else you can do with ASIN is we have a program called proxy calling, where I mentioned earlier that some autistic people don't speak. And even if we do speak, a lot of us have trouble talking on the phone. So when I'm out here saying to the autistic community, please make phone calls to your senators and representatives, that's not a popular pitch. So what we can do is we can have volunteers who don't have trouble talking on the phone place calls for people who do have trouble talking on the phone. So you'll sign up, someone will send in what they want to say. You'll call their representative's office and say, hello, I'm representing a constituent of Representative so-and-so. They can't talk on the phone, but I can. And here's what they want to say to you. And we've trained congressional staff about this. It's something that we're trying to make people more aware of so that they understand this is a legitimate way that constituents can contact their elected officials. But that's really a way you can make a difference, assuming that you enjoy making phone calls.
You know, it's not my favorite activity, but it's not my least favorite.
For sure.
Absolutely. Well, Zoe, this has been so helpful and I think such an important conversation. Is there anything else you'd like to touch on before we wrap up?
It's always Medicaid that I mention when people ask that question, but I actually was able to talk about Medicaid already.
Perfect.
So no, I'm good.
Perfect. And for people who aren't aware, Medicaid is on the table in the current big old, what I think Trump calls a big, beautiful GOP spending bill that's currently making its way through the House.
It is. And they're actively denying that it is. But it is. So call your members of Congress and tell them not to cut Medicaid. That's a really important thing you can do.
Absolutely. Well, Zoe, thank you so much for joining me. I really appreciate it.
Absolutely.
And I'm your host, Emily Gross. We'll be back next week with another episode of Bureaucracy.